Welcome to the Scale Healthcare Technology and Innovation Podcast, where we explore how innovative technology is revolutionizing U.S. healthcare. Hosted by Jason Schifman, President of Scale, we sit down with industry leaders to uncover the strategies, breakthroughs, and technologies shaping the future of care. Join us and subscribe as we dive into the cutting edge of healthcare innovation.
Welcome today to our next Technology and Innovation within Healthcare podcast, where I'm pleased to be joined by Andrew Ritter, the CEO of Cairns Health, a company that's focused on unique solutions within patient engagement, specifically on the senior care market through their product, Luna. I want to spend a lot of time today talking about Cairns because it's quite an interesting solution and very relevant to some of the macro trends in healthcare. But I want to begin by your personal background, which is super interesting. You were the founder and CEO of Ritter Pharmaceuticals, and then you had a chance to migrate into applying technology to diagnostics within healthcare, and now transitioning to a technology patient engagement function. And so it's quite a journey, and would love to hear a little bit more about that journey.
Thanks, Jason. Appreciate you having me on today, and I'm excited to be here. Quick background on myself. So I'm a healthcare executive. I've run healthcare technology companies for nearly 20 years. As you mentioned, I actually started on the biotech side, founded a company called Ritter Pharmaceuticals that was focused on microbiome-based therapeutics company. And I took coming from literally early stage phase 1 clinical studies to late stage phase 3 clinical studies. We were developing a treatment for lactose intolerance back then, and I founded the company based upon my own personal affliction with lactose intolerance. So it was definitely a near and dear to my heart company and mission. And ultimately took that company public onto the NASDAQ. And we sold that business in 2020 when it was in phase 3. So I really saw the whole arc of starting an early stage biotech company, raising angel money to VC money to taking it public. And so I saw the whole, life cycle in many ways of starting a business. And I really enjoyed that experience. And so after I exited Ritter Pharma, I got connected to Middle Coast Ventures and started supporting portfolio companies of the fund, and started off with a business called DocBot, which utilized AI to help detect and diagnose GI disease. And so it was really software as a medical device. And the biggest challenge is it was early in the AI days of like, well, what do you do with this? It's a cool technology. You could use AI to help detect patterns in colonoscopies, for instance, or for upper and lower GI. And what do you do with that? Like who's going to pay for it? What's the utility of use for it? So we really built out the whole commercial strategy for that business, and ultimately sold that to a strategic. And once we did that, I was then Costa asked me to step into another company, which is Cairns Health, the one that you referenced that I'm the CEO of today. And so I've had a real journey of really taking cool, interesting technologies and really taking on the challenge of how do we commercialize them in a meaningful way. And, I'd like to sum up the differences between biotech and digital healthcare and the principles around in biotech. It's pretty simple. If the product or the therapy in a clinical study works and is safe, FDA will clear it, doctors will use it, payers will pay for it, patients will use it. It's really like, you got to go up the hill, but then like down the hill, it's pretty easy and smooth. On digital healthcare, it's like the opposite. In many ways, it almost doesn't matter if the product works or it's safe. Who's going to pay for it? And what's the utility of use, right? Who's going to use it? And if you get those two right, obviously then the product needs to work and the applications. But it really starts with you can have the best product in the world, and if you don't have a customer or a distribution channel, it's not going to go anywhere. And you can have a really, really poorly delivered product, but if the customer's there and the payer wants to pay for it, you got a good business. And so as I've learned these principles, it's really helped me in navigating how to commercialize these different type of technologies.
So maybe that's we'll come back to DocBot in a second. I want to spend a bit more time on comparing your DocBot experience, which is AI technology, to Cairns Health. But maybe that's a good opportunity to just briefly introduce Cairns Health. So what is the company focused on, and what are you offering today?
Sure. So the company I'm running today is called Cairns Health, and we're a business that's focusing on remote monitoring and really patient engagement at the home to connect patients, providers, and caregivers on the same tech stack by providing what we call a digital care companion, we call it Luna. Think about Luna as a proactive Alexa for healthcare, where Luna is a digital device that sits in a room and proactively communicates care plans, patient reminders, medication reminders, does global assessments, all digitally with Luna, bidirectionally with the patient, and that information they can get captured and provided to the provider and the caregiver. So think about it as an aid in the home, a conversational AI in the home that can communicate with the patient bidirectionally, which really empowers the patient to be a part of their care journey, to be able to communicate to the providers and caregivers how they're feeling and how they're doing, while really reducing the burden on the caregiver and the provider and being able to monitor that patient more effectively. Because what it does is it triage for the caregiver and payers or the provider what's important, which patients need to be addressed and why, and alert where a patient may need help, or alert where a patient predictively may be going down in a situation where their illness or their challenges may be getting worse, and we can be more preventive by utilizing tools like this.
So companion plus monitoring, and I think you mentioned Alexa is a good analogy. So are these patients, are they chronic condition patients? Are they elderly patients? Are they home care? Are they in a facility? What's the patient demographic that you're focused on with these capabilities?
The patient demographic is really patients that are aging or being cared for at home. So it could be polychronic patients, it could be chronic patients, acute patients, any patient that needs to be monitored at home. This tool and platform can be helpful for. Our two markets that we're initially focusing on would be the home care market, so remote monitoring, chronic care management type of programs, as well as the senior care focused on independent living. And so we kind of see ourselves as the last mile, the last touch point connecting a provider into the home with the patient. And we're trying to reduce the barriers and the burden on all of the stakeholders to allow for patients to be able to be monitored more efficiently and cost effectively, but with higher care because of the communication going back and forth between the patient, provider, and the caregiver.
So let's get into some details of when we say monitoring or when we say companion, what specifically that means. What are you monitoring and who are you monitoring it for? And what does that companion functionality include?
Yeah, so it starts with, we have a radar technology built into our system, and we can monitor everything from vitals, so the heart rate, respiratory rate, and the sleep stages of the patient while they're laying down. And then we can do context in the room. So we have an enriched radar technology that allows us to know whether they're in their room, whether they're in bed, whether they're getting out of bed, whether they're awake. And this allows us to then proactively communicate with the patient. So let me give you an example. Patient wakes up. Hey, Jan, just saw you woke up. How do you feel today? How are your swollen feet? Are they swollen today? How is your back pain on a 0 to 10 scale? How severe is your pain? These are immediate questions that we can ask the patient to see how they're doing. And triage, if they're doing great, that's wonderful. We can move on. But if they're having symptoms or pain that's worse than, let's say, the previous days, we can alert someone to do something about it. So there's global assessments type of questions, which I just described. We can also do things such as medication reminders. Hey, Jan, it's 10 a.m. It's time to take your meds. Have you taken your meds yet? Right? This is a conversation we're going to have with the patient. We can also do things such as remind them to do tasks that they need to do, whether they it's a COPD patient or a CHF patient, where we can remind them, hey, it's time to weigh yourself, or you haven't taken your blood pressure yet. Like, those are types of things we can provide nudges and support the patient in their care journey. The companion part that comes into it is that we have large language models built in to have communication with the patient. We want to be the friend of the patient, and that includes being able to communicate with them like a friend would. And so our Luna system acts as a digital companion, supports loneliness, supports asking basic questions, and it's almost like having a nurse in the room in many ways to support the patient. I like to say it's like having a nurse in the room. The only thing that our Luna system can't do is scramble you eggs for breakfast in the morning and tie your shoes, but everything else it could do.
So, I mean, it's fascinating because I think the ability to have eyes and ears on a patient at home 24/7, and to not just have eyes and ears, but also to be helpful in the care program sounds like it could be broadly applicable. But my mind also goes immediately to the risk, the liability associated with that. And so if you're responsible for caring for a patient, you're responsible for caring for the patient. And so maybe can you talk about what are the limits of how do you think about that sort of risk and liability perspective? What are the limits of the solution? And you mentioned about escalation. What do you have in terms of integrating your technology solution with care providers who are monitoring the tool and who can escalate accordingly?
Yeah, I think first of all, I think these are great questions. So thank you for these questions. The healthcare system today, especially providers, are inundated with patients and they're overloaded. If you look at Mass General just this week laid off a significant amount of labor to reduce costs because it's just too costly right now to manage patients. And there's a massive push to manage more patients at home where it's less costly. Where the risk is managing patients at home has massive risk. You can't see them. You don't know what they're doing. You don't know if they're following what they're supposed to be doing. And so right now there's actually a massive amount of risk of being able to manage patients at home. The question is how do we reduce that risk? How do we create more of a scalable form that we can monitor patients at home safely? Because we all can't have a caregiver at our home. As much as we all would want a caregiver by our bedside to monitor us, that's just unrealistic because there's just not enough caregivers out there. It's costly and there's just limited resources. So we are a huge believer that digital solutions help break that barrier to be able to allow us to more safely monitor patients at home and deliver care at home. And that's what we're trying to address with our technology. And how we de-risk providing better care at home to patients is we empower the patient to be a part of that care journey and be able to communicate how they're doing so that we're aware of how they're feeling and how they're doing. In addition to that, we're putting the caregiver, the provider, and the patient on the same tech stack, all in the same communication workflow so that they're all in communication. So there's less gaps in the patient's care. And finally, being predictive. Being able to be predictive based on the data we're capturing from that patient to be able to alert, whether it's a patient, the provider, or the caregiver, hey, Jan woke up 6 times last night. Maybe we should check out if she has a UTI, right? Or Jan's not sleeping. Her breathing rate has changed today compared to the last 7 days. You might want to check on her, how she's doing, right? These are predictive forms of data analytics that we can utilize to create more actionable insights for providers and caregivers to then be more proactive and help reduce the risk of that patient's illness getting worse and for them to have to come to the hospital, which is more costly for the healthcare system.
Is this a tool that I'm, as a patient, let's say I'm a senior aging at home, am I choosing to go buy this product on the market? Am I going to Amazon and ordering a Luna? Or is this something that my doctor is giving to me? How does that work?
Yeah, we're starting off supporting providers. So there's a couple ways we will distribute our product. One is through remote monitoring and home care organizations, and the other is through senior organizations that focus on independent living. So if you're an independent living individual, you want to stay independent, we can help you potentially stay as independent in the independent segment longer. And so you'd get this through like a senior care organization. And that's how we're looking to offer. We're looking to offer it more as a B2B healthcare solution and less on the consumer side to start, but we obviously see great applications for this on the consumer side.
Let's walk through a case study. So, I mean, firstly, how many patients or clients, however you think about it, are you installed with today?
We're just rolling it out. We have 2 partnerships in hand right now. One is with an organization called Vitality, which is a senior care organization, and we started rolling it out in January of this year. And then we also have a relationship with Indiana University, where we're actually focusing on patients with early stage of Alzheimer's and sleep. And so we're planning on rolling that out coming up in Q2.
Got it.
And so we have a couple other partnerships that we're starting to roll out as well. And so we're looking at rolling out our platform essentially this quarter right now.
Okay. So maybe we can take Vitality. How did that partnership come about, and walk us through, the deployment process?
Yeah, situation. This organization focuses on senior care. We got the relationship through one of our strategic advisors. It's a great forward-thinking organization that is really interested and hungry to try out new technologies to see how they can better serve their patient population. And so in this situation, what we did was we went to them and said, hey, here's our technology, here's the platform. We see us as we have a platform, a tech-enabled service that we can take any care plan that a provider has and put it through our platform. So we went to Vitality and said, hey, here's what our solution can offer. And with the Vitality group and their leadership, we gathered their pain points on what their challenges were and how best to manage their patients. And we built a care plan out to support them in their needs. It's wild to think that. I'll give you one example. One example is in one of their facilities to check if the patient woke up in the morning, like is breathing and woke up in the morning. The patient's supposed to put a sock on the door, like on the door handle. Yeah. I mean, like, that's crazy to think about. Like, we're checking on our patients by them putting a sock on the door. Like, I feel like that's maybe the 1900s, but in 2025, that's what we're doing to monitor patients.
So it sounds like you really do get into your partner's needs, and there's some level of customization to what are their use cases. So maybe the application for the Alzheimer's patients at Indiana University might be different than the Vitality patients.
But what we found is that 90% of the pain points are very similar. But it's about then the care plans. And so one provider might have a different care plan for CHF over another care plan, as an example. CHF is one of the categories we're focusing on. And so what we do is we provide the care plan for that specific provider through our platform. But many of these care delivery programs are very similar. There's a lot of synergies between them.
So as a provider, if I'm Vitality or Indiana University, what are the target results that you would expect in terms of how they would measure this program?
One, better engagement. So patients being engaged with what they're supposed to do and them doing it. So that's number one. Number two is reduce burden and more work efficiency, if you want to call it, but less work for the caregiver to service that patient. And the third would be clinical outcomes. So being able to show that the patient not only was engaged more, but the action they took helped reduce or improve their care, and it reduced whatever care plan they're on to ensure that the patient was doing well from a clinical perspective. So they'll be the top three categories. The fourth one, which I'd be remiss to mention, is ROI. So a lot of our programs are based on how do we help reduce the costs to manage that patient. And so if you look at home care, a lot of it's very costly to monitor patients at home. And so one of the key things is not only do we want to reduce the burden on the caregiver, the provider, but the cost for them to deliver that care to the patient. That'd be the fourth piece.
In some ways, it sounds like a no-brainer. You have the ability to cost efficiently have eyes and ears on a patient and expand what you're able to measure. So it raises the question, why would you not want that? So what are the challenges for implementing this? Why would a group not be a good candidate to roll this out? Is it cost? Is it operational workflow changes? What are some of the challenges to broad deployment of the product?
Yeah, great question and great challenge that we all face. I think it's actually a traditional challenge we all face in digital healthcare is change. Change is hard, especially in healthcare. When you look at change, everything's about workflows and about how providers provide care. And if you disrupt that flow, whether it's good or bad, or it creates more efficiency or it's faster, it just changes hard to mold to. And so for us, like, we're trying to do everything we can to not create too much change, but to fit within the healthcare delivery systems and deliver it to the patient in a form that is within that workflow, essentially. So that's like a key piece to ensure. That's why when I mentioned early on, if we're looking for the care plans of that provider, it's one less barrier that, okay, it's their care plans. They don't need to change how they provide care, right? It's their system. It's what they know. It's what they want the patient to do. It reduces the barrier. It creates less change for them. So those are some of the things we're trying to do to help with the dissemination of a device like ours. The other piece to that would be you got to get into the home of the patient, which I think we all see is pretty challenging to get into the patient's home. Once you're in the patient's home, you're in a great position because you can then have access to that patient. So you have that heavy lift up front to get in the patient home, but once you're there, you're there. And ultimately, I think you referenced this earlier in one of your questions. Ultimately, what we want to be is the healthcare hub. We want to be the tool in the home that can connect and provide information insights to the patient, provider, and the caregiver. So it may not just be our device that could be radar that could show heart rate, respiratory rate. It may be that we connect to their Fitbit or their Oura Ring, or maybe it's their other wearables or devices that they have that collect information, but it all can be aggregated together in one place.
Is there a way to communicate live with the patient through this tool? So if there was some situation where a provider needed to interact with the patient, can they talk through the
So right now you cannot directly talk live to the patient. You can send messages to them that's typed down and sent through the device. We have on the roadmap and the vision that we can immediately bring on a provider onto the device if need be to communicate with the patient. So let me give you an example. Patient goes, geez, I don't feel well. I feel dizzy. Okay. Will it be like, okay, you feel dizzy? Like, is it a, 5 out of 5? Like, are you okay? And, Jan could be, I might faint. And Will could be like, let me get your provider on the phone. Boom. Hi, this is your doctor, Jan. How are you feeling? Right? Like that ideally is where we would want to go with this. So the provider can get on the phone immediately if there's an emergency of some sort for that.
Who's entering and how are they entering the information? So medication, here's the program that we're looking for the patient to adhere to. I assume that's the doctor is going into the software in his or her computer and entering it on their end.
Yeah, it's more like the caregiver. We call it the caregiver or someone within the provider organization. Like remote monitoring companies would do it in support of a provider. And again, it goes to their care plans that needs to be pushed through to the patient. And that's how it's done.
So give us a sense, and in terms of payment, is this is the patient paying for the product or the provider paying for the product, the insurance company paying for the product?
Yeah, so this is first of all, it's a per patient per month model. So it's more of a subscription model for the provider. So the provider or the home care organization will be covering the cost of it, as well as on the senior care side, it would actually be patient. So it would be like most likely a loved one that's supporting their elderly family member. And it's more of a superior way to monitor that patient to feel a peace of mind that they're being taken care of. And one of the key pieces to the roadmap on our senior care or independent living side of things is being able to have an email and communication to the loved one, letting them know how their loved one is doing. So, in many ways, it's more like a report card in many ways, a pass-through report card that a loved one could get to ensure that their loved one is being taken care of for peace of mind. Because many of us, we don't live in the same city as our loved ones, right? We might be tens of miles away. And so how do you know how they're doing? Like, besides picking up the phone and calling them, I don't know about you, but my grandmother, like, her phone's never charged, it's not next to her, and it's hard to get a hold of her. But if I could wake up in the morning and have an email report of, grandma slept well last night and she has no symptoms, and nothing has changed in her daily routines, that gives me peace of mind. That's great.
Using what you've developed, what does the ideal sort of delivery ecosystem, strategic partnership ecosystem look like? So I guess one question I have is, if you're deploying to a hospital, how important is it that that hospital has a home care service line to connect what they're hearing and seeing in the home to what their care teams are able to offer at the hospital? Are they missing that intermediary piece of being able to actually deploy providers into the home, or is that not necessary?
I think what we're trying to do is we're trying to create more of a scalable form to be able to monitor that patient at home, where you don't necessarily need a caregiver to go to that home, or the amount of time the caregivers need to go to the home is less. As an example, maybe you don't need to do someone overnight because we can monitor them safely with our device. Obviously, if the patient needs to get out of bed in the middle of the night to do whatever, that we can't do that, but we can at least monitor their safety and key vitals and key information overnight, as an example, to reduce the burden on caregivers. We kind of see our device as more of a way to scale care to patients at home. So you don't necessarily have to have that caregiver there 24/7. It's not perfect, obviously, because we can't do everything, but we're definitely reducing the barriers and providing at least some care that is meaningful to the patient.
I think it was Emory Health recently partnered with Dispatch Health. So there was Dispatch Health was providing the home care component, among other things, but home care, mobile care for the hospital system. But you could see you're Cairns sort of plugging in as a third leg to the stool between this tri-party partnership. You're the technology, Emory is the hospital, Dispatch Health is the connective tissue between the hospital and the home as relevant. Is that type of model something you've explored?
That's exactly the type of models we're exploring. So we're in communication with many remote patient monitoring and chronic care management type of companies that do exactly what you just described, where they support a provider like a hospital. You mentioned Emory Hospital. They do the next step of connecting to the patient to provide them the right monitoring tools, and they monitor the patient. So those groups are key ones for us to support. Ultimately, we really believe this is going to be supported by payers and hospital organizations once we show more ROI and clinical outcomes with the home care group. But it's all about showing ROI and cost efficiency to be able to have quality monitoring patients at home.
Because you're in the care delivery ecosystem here, did you have to go through an FDA process, or this is not an FDA approved requirement?
So it's not an FDA approved requirement, because what we really are is a conduit, a tech-enabled service that allows for more communication between caregivers, providers, and patients, and we're not making any clinical decisions. With that said, there's one component of our program that, if utilized for medical purposes, does need FDA clearance, and that's the fact that we can do vitals. We can monitor heart rate and respiratory rate. Those data points are going to be used for clinical decision making. That component needs to be FDA cleared. We've explored it. We may consider going FDA clearance for that. But for the time being, the use case of it to show trends in longitudinal tracking of the patient's data that could trigger, hey, we may want to get this patient tested for their heart rate, respiratory rate, and get a valid score that's under an FDA cleared device. Like, we can figure for that right now. And from the standpoint of going to market and piloting and testing this, getting customers, we don't necessarily need the FDA clearance stamp for that piece.
I'll come back to where I said I was going to start, and then I changed my mind by talking about DocBot over to Cairns.
Yeah.
So what is the role of a CEO of this company? What is the skill set that you think is particularly valuable to a company of this stage? And what, from your background, whether it's on the AI side at DocBot or the pharma side at Ritter Pharmaceuticals, are you drawing upon to apply that to how you approach Cairns?
I think it comes down to focus. There's so many places and directions you can take these businesses, but you can't be everywhere and everything for everyone. You really have to pick your battles and create direction for your team, for your investors, for your potential customers, your partners. So to me, it's really about setting direction and being really dogmatic about that vision and direction. So for us, we have a clear mission here. And the clear mission is that we're trying to address two of the biggest challenges we face in healthcare today: rapidly aging population with not enough caregivers to care for them, and the desire for patients to age and be cared for at home. That's what we're delivering a solution for. And so our work, our priority, our focus and direction is all based on that: delivering a digital care companion that supports patients at home. That's the key role for a leader and a CEO.
So defining focus and then resourcing the organization accordingly. With that and your current focus on this patient demographic, I'm curious what, if any, role the corporate MSO market plays as a strategic partner. So these large, pick a specialty that's relevant to an aging population, whether it's urology, whether it's orthopedics, whether it's cardiology, non-hospital based specialty MSOs. Is there a place for them to work with Cairns and use your product, or is this really for large health systems, large patient monitoring businesses, more so than specialty specific corporate MSO?
It all comes together. So on the specialty side, there's a lot of specialty organizations that focus on that have home care components to it. And so that's where I think there's a lot of potential collaboration opportunities to work with MSOs. MSOs support, in some situations, the remote monitoring or the care of patients at home for select indications or patient populations. And those are right for support where our device could be very helpful in supporting those patients. And so MSOs could be a way for us to scale and really be able to find more patients and more customers to scale our organization.
Is that part of your go-to-market approach, or you're more, you use the word focus, or are you more focused on those RPM hospital relationships for the current stage?
We're starting with hospitals, providers, and home care and senior care organizations to start with. And I'm sure we'll add other services and groups to the mix as we build our customer base.
Let's talk about looking forward to the vision, the next phase of your development. So you fast forward 12 months and then fast forward maybe 3 to 5 years. What's changed in terms of product functionality? What's changed in terms of market focus based on where you see the company going?
I think first and foremost, this next year is to get the product in market and to show ROI and the value of the offering in the patient's homes. I think within 3 to 5 years, it's about expanding the use cases and being able to have a footprint in the patient's home. So going back to the idea of being a healthcare hub and being able to take other data points, being able to create actual insights off those data points and provide them to the stakeholders. To me, that's where this is going. And that's super exciting. Like to be able to predict, hey, Jan may have X illness. If she continues down this path, we should do something about it. We can help prevent that illness from getting worse. So she doesn't have to go to the hospital because we identified it in advance. That'd be awesome. I mean, that would save the healthcare system a lot of money. It would help Jan. It's a win-win situation. And for us to help be more proactive in reducing the cost in healthcare and be able to scale better quality of health across the board to all, whether it's the underserved or the served, like these are the tools to get us there.
You mentioned integrated approach, or you alluded to integrated approach, so maybe drawing from other tools so that you're the center of patient's holistic care coordination and patient engagement from home. Mm-hmm. How feasible is that to do if I'm a patient with many different providers with many different systems? So my cardiologist might be an independent practice, my urologist might be part of a hospital system. Do you need a care team that's all part of the same EMR, all part of the same system, or are you able to pull from providers in different parts of different organizations?
Great question. So, I mean, for one, we provide central data for a variety of providers that may support that patient. So it's at a minimum, what we do is become a central hub of the patient's voice in their care journey. And we can then tack on, as an example, if they have a cardiologist needs to be, or the gastroenterologist needs to be connected to the patient, they can both be on the same tech stack to be able to understand what's going on with that patient. So in many ways, we're bridging the gap between providers. Ultimately, one of the things as we move forward is how do we create integration with those provider EMR and EHR tools? And I think that's something that as we move forward, we will definitely explore because, you know, we've discussed also on this call, workflow is really important. Like being able to have workflow efficiencies, like that's really paramount. And so that's going to be a key piece to this as we build this out. And as we are more robust, we're going to have to really keep that in mind to make sure that we're conducting these pieces together.
How's patient adherence to using the product? Are patients receptive to using it? What does it feel like from the end user perspective?
So far, it's been great. Like we get a lot of comments that the users find it really easy to use. It's funny. We did a pilot with my grandmother. She's 102, and went to her senior care organization, and we had them test out the Luna device and talking to it. And you know, initially I was like, I'm sure they're struggling how to talk to Luna. Like, this is new technology. And I was shocked to see how well they were fluid with it. And they could talk to the Luna device and navigate with Luna very easily. And I think in retrospect, when we did this pilot and test, what we realized is that seniors, more than anything, like they might have technological difficulty, like using the phone. But when it's using your voice, they know how to use their voice. Right. They've used their voice for many years. And in so many ways, it's becoming more of like a less techy item because all it is your voice. And so it's almost like a lower barrier to communicate with the patient because it's almost on their terms. And that our prediction is that's going to turn out to be a very instrumental piece to how our offering will work.
Yeah, look, I think Alexa is probably the easiest technology tool to use because all you need to do is say the word Alexa and it starts. That actually makes a lot of sense. Are there other applications for seniors, maybe thinking, healthcare adjacent that you have in mind, whether it's other forms of engagement? So it could be training or learning opportunities, but other ways to keep maybe a slightly younger senior engaged, their mind active, or do you really want to stay very much healthcare patient engagement, clinical focus?
We really want to stay more patient engagement and clinical focused. With that said, there's some really cool stuff that we're tinkering with that we think could be additive. I'll give you a couple examples. One thing is loneliness, as well as brain games. So keeping seniors or elderly more engaged. Like there's a lot of health benefits, just communicating with the patient and providing games with them and keeping them thinking. And so there's a lot of health outcomes data that shows that that's really helpful to the patient. So that's one category. And then we're looking at a whole other category when it comes to voice sediment and more on the concept of sensor fusion, taking multiple signals and putting them together. But on the voice segment part, as an example, the audio of communicating with the patient, we can take that and utilize AI to better screen for if the patient has depression or anxiety or stress or early sort of Alzheimer's. So there's a lot of things we do with the voice too to enrich decision making and gain more clinical insights. So in many ways, this becomes a really big opportunity where there's a lot of places where you can take it to be clinically relevant and supportive to the patient.
Who else is, you don't need to get into names, but how many other groups are focused on a comparable solution, and how do you think about differentiating your offering versus?
Yeah, I think we always all face that, right? Competition. And, I think one of the greatest things about where we are is that innovation's rampant in our healthcare system to try to improve the lives we all live in. That's great. When it comes to our specific category, there's a ton of individuals trying to face the challenges of how do we solve home care and senior care and with digital solutions. And I think a lot of the technologies, many have become very complementary to what we're doing. So as an example, using voice sediment to detect certain indications for the patient, my preference is really to partner with someone that does that already and be the conduit for them versus developing on our own. So I think in many ways that company becomes complementary and not a competitor. When it comes to competitors directly, there's radar companies out there that does radar that can monitor a patient fall, monitor patient vitals. But what we've seen is that data becomes overwhelming for a provider without it being compartmentalized into a decision making, what do you do about it? And then can you do that for me? Because I don't want to do it, right? It's called information overload. And then there's devices like Alexa, which we've kind of referenced already, which is a reactive voice engagement. So, hey, Alexa, play me music, right? It's really reactive. We sit right in the middle where we have the radar to create contacts and take some key vitals. But that context allows us to be enriched to be able to then communicate to the patient proactively and be like, hey, Jen, just saw you look up. How do you feel as the example? And so that's what really makes this novel is that we can be proactive. And we have one of our probably greatest strengths is the amount of patents we have issued that center around this ability to take key contextual data in a room, digest it, and be able to then proactively communicate with the patient.
Look, when you think about the segments that you're playing in, I mean, hospital at home, I think was projected to grow 50% over the next 3 to 4 years. Home health is listed as one of the top projected areas of growth in terms of profitability over the next 5 years. So you're playing in spaces that are big, growing, ripe for disruption. So it's pretty cool to see something as practical, simple, and intuitive as what you've built at Cairns. So it's wonderful to learn a little bit more today, and appreciate the time, and wishing you lots of luck. It's a great solution that you've developed.
Well, thank you very much. I really appreciate you having me on your show today. And if anyone's listening, they want to follow us, Cairns.ai is our website. And we really appreciate the opportunity to share our vision and direction for our business.
Good. We'll follow up. We've got some ideas on that as well. Thanks so much, Andrew. Really appreciate the time.